I'm gonna guess which of these 7 beautiful people behind me have had plastic surgery. Let's find out.
Before we have Dr. Linkov come in and guess, I'd like you all to try and rank yourselves from who's had the least amount of surgical procedures to the most.
Okay. Hi.
Hi.
Hello.
Okay, so who's had the most procedures?
I'm willing to fall on that.
1, 2, maybe, right? Oh, you can't say it. Okay, 1, 2.
Well, I would put you over
You stay there.
I'll go
Here, let's go over there. Come over there. Okay. You come over here too.
Okay. Where should I go?
You come on this side. I think you should go over there. Yeah. 1, 2. You're right there. Yeah, that's good. In the middle. Right
In the middle. There's a middle now?
Right here. Okay, we're good.
I think I had the least plastic surgeries just based on the other candidates.
I feel that I got placed here maybe because I try to emulate a very natural look in that.
Yeah, I feel like you're giving natural. You're exactly where you should
Okay.
be.
I feel like I am placed here because I'm questionable. You don't know what to think and see. You don't know what's what. So I guess later on we'll find out, right?
I don't know if I'm in the right spot, but I also like to look natural. So I guess we'll see at the end.
I feel quite flattered. I don't know if I'm like on the correct spot in the line, but I definitely am like, oh, okay. I think I got work done.
Well, I'm offended that you put me all the way in the end of this list. I think that I look natural and beautiful and everything is working. So how dare all of you?
I think it's no surprise that my appearance bodes to some possible work done. Not going to disclose if that's true or not, but I do think I'm in a logistical position here. I don't know about this whole group, about the order, but I do think I make sense where I'm at.
I think so too.
Thank you.
It's gonna be embarrassing how wrong I'm gonna be. Hey, Dr. Gary.
Nice to meet you.
Nice to meet you. How's your morning going so far?
Good. How's yours?
Pretty good, pretty good. This is all a little bit different, but getting used to it. All right, you mind if I take a look?
Yeah, go ahead.
Okay, all right, let's take a look. Let's see. I always start with the hairline. That looks very natural. Got a cool tattoo here. All right, just behind the ear. Let's see. Okay. And then if you can raise up your eyebrows for me. Okay, and just like kind of wrinkle your nose around and like angry face. Okay, maybe a little bit of like baby Botox in the glabella, and then if you can close your eyes for me, all the way closed. Yep. Potentially, I see an upper blepharoplasty scar, so that's a possibility. And then if you can raise up your chin for me, could be a rhinoplasty. I see a small little scar there, so there could be some signs of nasal work. Part your lips for me. And then a big smile. I see a little bit of some of the filler potentially settling out. So maybe lip filler, maybe a little bit of lateral cheek filler, though I'm not sure. And then let's raise up the chin for me. And then it's a little hard to tell, but possibly a small little submental incision, maybe for some submental lipo, but not positive. But you look great.
Thanks.
It's nice to meet you. Thank you.
Ooh, what do we have here? Facial cleanser. A good facial cleanser is the key, right? You gotta get all those bad oils out of your face. Okay, I think I'm gonna grab this one. Thank you.
I'm Dr. Gary.
Matt.
Nice to meet you, Matt. What do you do for a living?
I work in marketing.
Oh, nice. Okay, great. You mind if I take a look?
Yeah, no.
Okay, all right, let's see. I like to start with the hair. All right. That looks like a natural hairline. Okay, and then around the ears. And raise up the eyebrows for me. Even more. Okay, and then angry face. Okay, possibly some Botox to like the forehead, the glabella, and then big smile. And maybe the crow's feet as well. And then raise up your chin a little bit. I don't see a rhinoplasty scar, but maybe sometimes with a closed rhinoplasty, you can't really tell. I mean, that could be your natural nose, but it's very well orchestrated, so some people just have that naturally, but it could also be potentially a rhinoplasty there. And then the cheeks, Maybe some cheek filler, though I'm not 100%, and maybe even into the nasolabial folds. Big smile. Nice. And then potentially the lips have some lip filler in them. And then chin up. Let's see. Okay. Yeah, I think the rest is very natural. So great.
Thank you.
Thank you so much, Matt.
Of course.
Okay.
If we had all of this, you'd just be set for life, day to day. But if I had to pick hyaluronic acid all the way, this stuff is very important in skincare. Love this.
I'm Dr. Gary.
Hi, I'm Juliet.
Nice to meet you.
Nice to meet you.
All right, let's take a look. Let's see. Hairline looks very natural. I always look around the ears for any scars. Very natural. Eyebrows. Okay. And then if you can close your eyes. I'm guessing maybe potentially an upper blepharoplasty, but I'm not sure. And then raise up the eyebrows for me. Okay, all right, that's good. And then wrinkle your nose. Okay, all right, good. I don't know, her nose looks very natural. That's great. And then if you can raise up your chin. All right, very good. Let me look at this side. All right, maybe a little bit of lip filler. That's just a guess, I don't know. And maybe an upper blepharoplasty, but those are my guesses at this time.
Okay, cool.
All right, okay.
Thank you so
Nice to
much.
meet you,
Nice to
thank
meet
you.
What's HA serum?
Hyaluronic acid.
Hyaluronic acid. Ooh, I think I want to take the hyaluronic acid. Thank you so
Love
much.
it.
Hey, I'm Dr. Gary.
Hi, Kate.
Nice to meet you, Kate. Do you live around here in New York?
I'm on the Upper West Side.
Oh, okay, okay. Thanks for coming down here for this. All right, you mind if I take a look? Okay, all right, let's see. I always like to start at the hairline. Okay, and then we look around the ears. All looks natural. You know, people are getting these facelifts so much younger these days, so we got to check. We got to check. Raise up the eyebrows for me. No, just like this.
Oh.
Okay, okay, and then kind of wrinkle the nose. Yeah, and then if you can just close the eyes. Okay, all right, and then let me tilt your head back a little bit. All right. Okay, no rhinoplasty scar, that's cool. And the nose looks natural, just like the last person too. All right, and then the lips just together. Okay, all right, and then chin back up. Okay, oh man, I can't spot anything. I think totally natural. Good, thank you.
Thank you.
All right, thanks.
I think I'm gonna try the thickening foam. How does it work?
You could try it now.
Okay.
Yeah, squeeze it out.
So you can use this on wet and dry hair.
Yeah, usually like moist hair after the shower, but yeah, you could put it on dry.
Okay. This is very nice.
Can give you some volume too, so.
I'm here for it.
Lovely.
Yay.
Hello, Dr. Gary. Hassan, nice to meet you. All right, what do you do for a living?
I do several things. I am an actor, I'm a singer, I do real estate, I'm a personal trainer.
Wow. Yeah, I could tell. Yeah, big, buff guy. All right, good. Mind if I take a look?
Sure.
All right, I'm gonna start with the back of the head. I do a lot of hair surgery, so I'm always looking for those FUE, FUT scars. Let's take a look. All right, and then chin back up. All right, raise up the eyebrows. Okay, and then eyes closed. Okay, great, and wrinkle the nose. Okay, great. Okay, that's good. Ears. All right. Okay. All right. Looking natural, my man. Yeah.
You sure?
I mean, the only thing I can think of is maybe like cheek filler. That's the only thing that comes to mind, but I've been wrong before, so we'll see. Great.
All right.
Thank you. Thank you.
Definitely go with this one, the scar gel. I get a lot of scars from working out and stuff like this. It comes and goes, and like on my face, and yeah.
That could be a good choice.
Yes,
I hope you like it.
I'm sure I will.
Hey, I'm Dr. Gary.
Hi, I'm Cervantes.
Nice to meet you, Cervantes. Where are you from?
I'm from New York.
Okay, all right, cool, awesome. Well, it's good to have you here. You mind if I take a look?
Yes.
Okay, great. I'm gonna start with actually the back of the head, because I'm a hair guy and a facial plastics person, so. And then let me just bring You have the hairline that many guys dream of. Yeah, let's see here. Around the ears, looks good, no scars. Okay, and then let's have you raise up the eyebrows like this. Good, and wrinkle your nose, and then angry face. Okay, good. And then just eyes closed. Okay, good. Big smile. Good, and then the lips just apart like this. All right, very good, and the lips together. All right, and then let me see, under the chin.
All natural.
Okay, it looks like it. It does look like it. I don't see any work that's been done. I'm probably gonna be wrong on this one, but I have nothing to call, so it all looks good. The only thing I would say is potentially the angles of the mandible, maybe a little bit of filler into those areas, but that's the only potential thing. So thank you so much. All right, Cervantes.
Okay, so facial moisturizer. I'm feeling a bit dry. Let's try this. Is it too much?
No, it's the right amount.
No, it'll blend in.
Wow, it feels really nice and smooth. Oh, I feel so refreshed right now. I think this is the one. I feel so good.
Hey, I'm Dr. Gary. Hey, Evan, nice to meet you. How's your morning going so far?
Good. So far, so good. I had a coffee.
All right.
Got it.
Me too. Awesome. And what do you do for a living?
I'm a music video director.
Oh, okay.
I shoot and direct music videos.
Okay, so you're familiar with all this.
A little bit, yeah.
You mind if I take a look around?
Go for it.
Okay, great. I'm gonna start with the back of the head, actually. Just looking for signs of like a potential hair transplant. You guys have a lot of good hair. Let me just see up here. Another outstanding hairline. It looks very natural. And around the ears, good. And let's have you raise up your eyebrows. Okay, and then like angry face. Nice, okay, and then eyes just closed. Just kind of a gentle close. Perfect. And then let's have you tilt up a little bit. Just look under the nose. That looks great. And then lips apart. Okay, and then lips together. Okay, great. All right. Make a muscle here. Okay, good. I think it's all natural. I don't see anything. But we'll see what the final reveal is. Nice to meet you.
Talk to you soon.
Thanks, sounds good.
I'll try the serum. Is that just for the face?
It's for the face. Yep, you can.
Just try it on your hand, that's
Yeah.
fine.
Do you have dry skin?
A little bit. In the winter time especially.
Yeah. Well, hyaluronic acid's really cool because it penetrates even the deepest layers of skin.
I think I'd have to go with the serum.
Go for it.
Sweet.
Do you like the influencer?
Definitely.
Cool.
Awesome. Thank
Thanks,
you.
Evan.
Yeah, thank you guys.
All right, so this is the original order. How did you guys decide on how to put each person in the place that they're in? Was there like a leader of the group?
I was kind of placed here, so I just kind of went with it.
Okay, all right. How come Matt's all the way there at the end?
I took ownership.
Okay.
I felt it was fair. I think the group agreed.
You just sort of looked around like, yeah, it's me. And Evan all the way down here?
Apparently I've had no plastic surgery done.
Oh, all right, we'll see what the reveal is.
All right, so now we're going to reveal who had the least amount of facial procedures to the most amount of facial procedures. And first is Juliet.
All right, Juliet. So, hey, have you had any procedures at all?
No.
Okay, all right. Have you ever thought about getting anything?
I've thought about it.
Like what?
Botox a little bit.
Okay.
Preventative. Open to it. I
Yeah.
just haven't had anything done yet.
Perfect, yeah, awesome. Okay, thanks.
Second is Hassan.
All right. You were hinting at maybe having had something done, and I didn't guess too much for you. So what have you done, if anything?
Just a little lip filler, just very slightly.
Okay, in the upper and lower lip, or just one of them?
The lower lip.
Lower one, okay.
Very little.
And what was the motivation for that?
Just more fuller lips.
Okay, cool. Are you happy with the outcome from it?
Yes, because it was very little, very subtle.
Subtle, yeah. Yeah, I always talk about people not overdoing the lip filler, you know, because a lot of people get like full syringes in there, and less is more usually.
Almost to the point where you can't even tell. So.
Yeah, I don't think I could tell. Awesome, thanks.
Third is Kate.
Okay, I don't think I guessed any procedures for you, Kate. Have you had anything?
Yeah, a lip filler.
Oh, really? Okay. Was it top and bottom?
Just the top.
Just the top, okay. Do you remember how much they used?
Like, I remember it was not a lot.
Okay, got it. And was it just like a one-time thing, or do you go back every like certain number of months?
It was a one-time thing, but I want to go back and just get a little bit.
Okay, all right, cool. Awesome, thanks.
And then we have Matt.
Okay, all right. All right, Matt, well, give us the reveal. What have you had done?
I've had Botox, my forehead between my eyebrows.
Okay.
Cheek filler, lip filler, and a little chin filler.
Okay, what about the nose?
Natural.
Okay, all right, very good. Because I guessed some of those things, but yeah, the nose was, that was a tough one for me. I was like, maybe a closed roundup, because I didn't see a scar, but very nice.
Next we have Cervantes.
All right. All right, surprise me.
So I got the buccal fat removal surgery.
Okay. How was that experience, by the way?
It was good. It was like a 20-minute procedure. They slice it open, they pull out the fat.
Were you
100%
awake for it?
removal. Huh?
Awake
Yes,
for
I
it?
was awake.
Okay.
Yeah.
Okay, good.
It
Recovery
was
was.
so good, right?
Yeah, I definitely. But what else? Anything else?
That's it.
That's it.
That's it.
Okay. All right. Very good. I thought like, oh, natural, but that's just yeah, one procedure there. Okay. Very good. How long ago was that?
It was maybe 6 months now.
Okay.
Yeah.
All right. Good.
Fresh new face.
Healed up. Okay. Very nice. Thank you.
Next we have Evan.
All right, he's in the right place, okay. So clearly I got it all wrong for you, so.
I've had 2 blepharoplasties done.
Oh.
Eyelid surgery. So the doctors actually removed a muscle out of my leg and surgically put it into my eyelid.
Oh,
So
okay.
helped with my vision, helped my eyes look a little more even.
Did you have like an injury at some point, or just the way that you
No,
were
I was just
born?
born naturally like that. So it was a corrective surgery.
Wow, interesting. Okay. I could tell there was a little asymmetry, but it's very common for people to have that. But yeah, that's a unique one from the leg. Yeah, cool. Thank you.
And then we have Ani, who is in the correct place.
Hello.
Hey, Ani. All right, I had a few guesses, but tell me where I was right and where I went wrong.
Well, I have had a rhinoplasty.
Okay.
You were correct.
Okay.
You said I had upper eyelid surgery. I have not.
Okay.
I think that was just my eyeshadow creasing.
That's what threw me off. Okay.
I've had cheek filler, under eye filler,
Mm-hmm.
jawline filler. I've had threading. I have Botox, and my lips done.
Okay. So yeah, most of those things I think we had talked about. Any regrets? Anything that you had that you were like, no.
No.
Okay. Happy with all of it.
Happy with everything. You have to do your research.
Yeah.
You have to get a good doctor.
How did you find like your doctor or the clinic that?
Online. Well, I got my nose done in Armenia.
Oh, okay.
Yeah, it's a really popular country to get your nose done because we all get nose jobs.
Okay.
We all have really big noses.
Okay.
But over here, Instagram.
Yeah.
Yeah, and just Google.
Perfect.
And doing your research and seeing the photos and reading testimonials.
Any complications from any of those procedures?
One time I passed out when I was getting my lips done.
Whoa.
Because they didn't numb me. And I was like, I
Really?
can handle it. It looked like I had a seizure.
So it's from the pain.
I was holding my breath.
Oh,
Yeah,
okay.
it was
okay.
from the pain. She just went, she started stabbing me and then
Yeah.
she didn't stop. And I was like, I just passed out.
Whoa.
My boyfriend was there though, like we went to the emergency room and everything.
Did you go back to that same provider?
No.
Okay. All right. Yeah, that's when you go back
Now I
to
had
the
half
search.
a syringe left, I left it.
Yeah. That makes sense. I probably would have done the same thing. Well, thank you so much.
Of course, thank you.
Is there anything that surprises you about this lineup?
I was surprised by Evan's procedures. I mean, I noticed something about the eyelids, but I didn't think that he had corrective surgery there, so that was probably the biggest surprise. The buccal fat removal, a bit of a surprise. But they didn't overdo it, I don't think, because it doesn't look too hollowed out. Most of the time when I do like the analysis videos online, kind of looking at, you know, like where they started, and when we don't have that, and it's just like, you know, this is the person here and now, it can be a bit difficult to know, like, did something change, or is just like, has it always been that way? Overall, I think everyone looks super natural, so I don't think anyone's like overdone it and, you know, gone sort of overboard, so I think that's huge. As I say in some of my videos, like the best plastic surgery or cosmetic procedures, they should whisper, not scream. So you don't want people to see you from, you know, down the block and be like, oh, that's clearly lip filler, or that, you know, they clearly had something with their cheeks, and so I think that's great. It's all about feeling confident, whether with or without plastic surgery, and that's exactly what the Feel Confident brand is all about. Thank you all so much for being so open about your journeys. All right.